Hi, everyone. For those who have not been in attendance previously today, my name's Erin Foley. I'm your moderator and co-president of NADF. For our next session on Cushing syndrome, we have a guest from Duke Endocrinology. Very pleased to welcome Dr. Shahla here today, who is the medical director of Duke Pituitary Center. And she has a specialty in Cushing's and acromegaly. And I'm going to hand it over to her since we're running a little late. And take it away, Dr. Shahla.
Thanks, Erin. Hi, everyone. I am honored to be part of this event today and take another step forward in spreading awareness about Cushing syndrome. Today, I'm going to talk to you about Cushing syndrome, what it means, the symptoms, signs, how we diagnose Cushing syndrome, how to treat, and what is it like to be living with Cushing syndrome. At the start, let me explain what Cushing syndrome is. It means when your body is exposed to high cortisol level for a prolonged period of time. That's what's called Cushing's. Cortisol is a hormone that comes from the adrenal glands. The adrenal glands are two glands located right above the kidneys. They make and secrete cortisol. Cortisol is also called stress hormone. It's a very important hormone that regulates your blood sugar, blood pressure, sleep-wake cycle, inflammation, and stress response. So we all need cortisol to be slightly elevated in certain times as response to stress. However, having high cortisol level for a long period of time is not good, and that's what causes or what's called Cushing syndrome. Some basics about Cushing's. Cortisol, as I said, it gets secreted by the adrenal glands and it is regulated by a hormone called ACTH. ACTH is made and secreted in the pituitary gland, stimulates the adrenal to make and secretes cortisol. Exogenous Cushing's is due to excess cortisol caused by taking steroid medication, high doses for extended period of time. Some patients need to be on medication such as steroid, let's say prednisone, dexamethasone, hydrocortisone. For instance, patients who have asthma and they need to take steroid frequently for frequent flares, or they have autoimmune disease such as rheumatoid arthritis, lupus, or they have frequent bronchitis and they take frequently steroid. Taking high dose of steroids for a long period of time, it will cause something called Cushing's, but this is all not the Cushing's I'm talking about. This is called exogenous Cushing's. On the other hand, endogenous Cushing's is due to high cortisol level that your body makes. And the cause could be either a tumor in your pituitary gland making too much ACTH, or it could be in the adrenal glands making too much cortisol, or other parts of the body, other kind of tumor making too much cortisol. And I'm going to talk about this in a second. When the cause for Cushing's is located in the pituitary, the syndrome is called Cushing's disease, and this is the most common cause of Cushing's syndrome. There's usually an adenoma or tumor, and most of the time is very small, secreting high doses of ACTH. When your body has high ACTH, that will cause the adrenal to continue to secrete cortisol, which will lead to high cortisol level, eventually Cushing's. The second most common part or kind is the adrenal Cushing's, and usually there's a tumor or a nodule on one adrenal gland or both, making too much cortisol. Now, the least common is called ectopic, when the source of high ACTH typically is a tumor that is not in the pituitary and not in the adrenal gland. It could be cancer, it could be infection, usually in the lung. Secreting too much ACTH eventually will lead to high level of cortisol. I'm going to focus here a minute on Cushing's, adrenal Cushing's. So as I mentioned earlier, ACTH is a hormone that is secreted by the pituitary gland, stimulates the adrenal glands to make cortisol. Now, when there's a tumor or a nodule in the adrenal gland secreting too much cortisol, it's going to give a signal back to the pituitary to stop making ACTH. So in these cases, the ACTH level is low and the adrenal glands are working on their own. And this is what's called ACTH independent. It could affect one adrenal gland or both. Most of the time, the cause is an adenoma or a tumor in one adrenal gland. In some cases, it can affect both glands, and it's called adrenal hyperplasia. Usually, there are small nodules in adrenal glands. And very rarely, adrenal cancer can cause Cushing's. This is very severe form of Cushing's, but luckily it is very rare. What are the signs and symptoms of Cushing syndrome? There are typical symptoms and signs and some that are atypical. Some of the typical include moon face, what we call it, or rounded face, plethora, where there's redness mainly on the cheeks, buffalo hump, which is a hump located right below the neck, and it's because of fat concentrated in that area. Unexplained weight gain, and it's not just weight gain, it's located mainly around the stomach area. It's called central obesity, and patients usually have thinner arms and legs. The skin tend to be thin, bruise easily, and patients usually have severe osteoporosis that will cause fractures from very mild trauma or minor falls. They also have muscle weakness. They may have diabetes. Some other atypical symptoms and signs include acne, increased hair growth. In women, it can cause insomnia, mental health disease such as anxiety or depression, high blood pressure, or irregular menstrual cycles. The point here is not all signs and symptoms appear in all patients. But for the most of the time, patients will have multiple signs and symptoms, but they don't have to have all of them, and two patients may not necessarily have exactly the same symptoms and signs. The diagnosis can be tricky because many of these symptoms may overlap with common conditions such as hypertension, diabetes, heart disease, osteoporosis, depression, and mental health disease, sleep disorders. However, if someone has multiple conditions at the same time, such as hypertension, diabetes, osteoporosis, and they have also insomnia, or they have anxiety and depression, that should trigger a sign that we need to screen this patient for Cushing's. Now, what I need you to know that diagnosis can take time. It's unfortunate, but yes, it can take time. It used to take years for patient to get to a diagnosis. Luckily, these days we're doing better in terms of diagnosing the Cushing syndrome earlier. It is important to mention your symptoms to your provider, and they will do a full physical exam, and from there they can screen for Cushing's. And to screen for Cushing's, we typically check cortisol in multiple ways, including blood cortisol, saliva cortisol, and urine cortisol. If the test or the lab show that the cortisol is high, we'll proceed with imaging to identify the source. If the ACTH is elevated and we suspect Cushing's disease or a pituitary source, we proceed with brain MRI. If ACTH is low or we suspect adrenal Cushing's, we proceed with CT of the adrenal glands. Now, sometimes if Cushing's or is very severe and we suspect ectopic Cushing's, we may proceed with a whole body CT or a PET scan. Important point I want to mention here that patients, when they present with early Cushing's, we may not have consistent results. They may have sometimes abnormal or elevated cortisol. Some other times we may have normal cortisol. So it is important for us to confirm the test and high cortisol level on multiple tests before we proceed with treatment and most of the time surgery. So we're not going to send patients for surgery before we confirm the diagnosis. And that's why sometimes we need to repeat the test multiple times to get an accurate to make sure the cortisol is actually that high and it is Cushing syndrome. So please be patient and do not lose hope. Eventually, we will get to the diagnosis, but it may take longer than you hope. Regarding treatment, the goal of treatment is to normalize cortisol and make patients feel better to improve their symptoms. First line is surgery. If the tumor is in the pituitary, the goal is to remove that tumor, and they're usually smaller tumors. If in the adrenal glands, the goal is to remove the adrenal gland. And if it's ectopic or cancer, the goal is to remove that tumor. And this can lead to cure in many cases. Now, in certain cases, full resection of the tumor might not be possible, especially in pituitary disease, because even though the tumor is small, it might be located in certain critical areas around the arteries, and it will be hard for the surgeon to remove it without causing damage or injury. So piece of it might still be there, and in that case, radiation is helpful. That will control the growth of that tumor, shrink whatever residual left, lower cortisol level. Now, what I need you to know is that radiation takes time to work. It could take a year or two. It works slowly. Eventually, it will work, but it takes time. In the meantime, to control the disease and lower cortisol level, we use medical treatment. Even in certain cases, if patient had surgery, let's say they have pituitary disease, they have surgery, but their cortisol is still high, and we cannot see anything on the MRI. That can happen if there is something called microscopic tissue or very, very tiny pieces of the tumor left that we cannot see it on images. Therefore, we cannot do radiation and we cannot do surgery, but medical treatment can take care of the rest in controlling the disease. And medication, we have multiple options. They may target the tumor itself or the tumor cells, or they may lower cortisol production or block its effect. Important tips for patients with Cushing syndrome. Find the right provider. Find your endocrinologist and make sure they have good experience in testing and treating Cushing syndrome. Also, make sure you have the right provider, as patient-doctor relationship is very important. Track the changes in your symptoms when you get surgery or radiation or start medical treatment. Keep a diary or a log of your symptoms, or if you have any side effects of medication, and make sure you discuss that with your provider every visit. Again, I will say, please be patient. I know, unfortunately, it's a long journey, and patients suffer for so long before they get to diagnosis. And once they get diagnosed, they want to get treated the next day and feel better the next day. Unfortunately, it's not that easy, because when your cortisol is running so high for so long and you get treated, your cortisol is back to normal, you're not going to feel good. And it feels worse before it feels better. It takes time, and most of the time it takes a whole year for your body to adjust to the normal cortisol level. So no, even though you're feeling worse, eventually you're gonna feel better. Find your village. This journey is difficult, is painful, stressful, so it is important to share your journey and your feeling and have good support among your family, friends, and patients group. There's a big Cushing's community group. I feel like it's very helpful for patients. It's called Cushing's Support and Research Foundation. Take care, take care of your mind. Mental health is very important here. High cortisol level usually causes anxiety and depression. Even when we treat Cushing's, it takes time for that to improve. So it is very important to take care of your mental health, talk to therapists, talk to a psychiatrist. You may need to be on medications. This is temporary and it should get better, but I know it's harder in the beginning. Also, do not forget to take care of your body. Having cortisol level for so long will cause muscle weakness, pain, um, and then which will lead to decreased activity level. With that, you can have muscle atrophy and make it harder to move around. Once your cortisol is back to normal, you may feel worse initially, but you need to get back there. You need to be active. You need to start exercising. I always recommend starting slowly and increasing the frequency and intensity gradually to build that muscle strength again. Physical therapy is very, very helpful. Sleep, as I mentioned, Cushing's or high cortisol levels will cause insomnia. Your body is sleep deprived, and that's not good for your well-being or mental health. So try to get enough sleep to guide you through that recovery journey. So take home points. Cushing syndrome means your body is exposed to high cortisol levels for long period of time. Signs and symptoms are different between patients. Diagnosis can take time. Please be patient, stick with it, and do not lose hope. There's always a light at the end of the tunnel. And we have multiple treatment options for Cushing syndrome once we have a diagnosis, and that includes surgery, radiation, and medical treatment. And thank you all for listening. I'm happy to take any questions.
Thank you, Dr. Shahla. Very, very comprehensive talk on Cushing's. I personally learned a lot. Okay, so we do have time for some questions. The first question coming in from our audience is, I was missed/undiagnosed for Cushing's from 2016 to 2020 caused by a pituitary gland tumor. Once that was removed, I was told I no longer have Cushing's. I now have secondary adrenal insufficiency. My question is, could I still have Cushing's disease symptoms, not from too much cortisol, but other symptoms?
So after treating Cushing's, the cortisol immediately after surgery should be very, very low. And this is what's called secondary adrenal insufficiency. We start patients on hydrocortisone, usually slightly higher than physiologic doses, and we start titrating down to get to a physiologic dose. It is very important for us to retest if you still have secondary adrenal insufficiency. So if you had low cortisol after surgery, it does not mean you're going to have low cortisol forever. So every once in a while, we need to recheck. If your cortisol is normal and you're still taking hydrocortisone, you're going to have exogenous Cushing's. You're still going to have symptoms and signs. Also, Cushing's may recur. Unfortunately, especially with pituitary Cushing's, it may come back. So even if you're taking hydrocortisone, and your cortisol is now normal and we stopped hydrocortisone, we need to continue to check once in a while to see if Cushing's is back, because if you still have symptoms and you're not taking hydrocortisone, it could indicate that you have a recurrence and you have to be screened and tested.
Okay. Another participant wants to know, what kind of Cushing's do you see the most?
I mainly see pituitary, which is the most common cause for Cushing's. It's called Cushing's disease. And I do also see some ectopic. I do have a few of adrenal Cushing's, but me personally, I see more of Cushing's disease.
So there's a difference between Cushing's disease and Cushing's syndrome?
So Cushing's disease is part of Cushing's syndrome. It means the source is in the pituitary. And this is what it's called, the disease. Syndrome is the general term for high cortisol. When the
Okay.
source is in the pituitary, this particular condition is called Cushing's disease.
Okay. And that same person, I think I know the answer to this, but can you have Cushing's and Addison's?
No.
No.
First of all, it's not Addison. It's called when you have surgery to treat Cushing's, you develop adrenal insufficiency. This is different from Addison. Addison is when you have an issue to begin with in your adrenal glands. It means primary adrenal insufficiency. Secondary adrenal insufficiency is when you have a tumor in your pituitary gland that was removed. That's what's called secondary adrenal insufficiency. Your cortisol is low after surgery. It's called secondary adrenal insufficiency. And that can happen after treating Cushing, but you will never have both at the same time. Remember, Cushing syndrome means high cortisol level. Addison or adrenal insufficiency means very low cortisol level.
Yeah. Yeah, I was part of an advisory board a few years ago that was for a Cushing's medication. And so I spent some significant time at the dinners and whatnot with several people with Cushing's. And um, as somebody, I have primary adrenal insufficiency, and like how different our diagnosis
Yes,
stories were,
yes,
and how many years that these people struggled.
unfortunately.
Um, Now, it's so for those of us who are on today with primary adrenal insufficiency, or secondary, even, who haven't experienced that, like, it just really, really gave me a different vision into, like, for primary adrenal insufficiency, often we're near death, but it happens pretty quick. And, as long as you get a diagnosis, you get treated fairly quickly, feel better fairly quickly. But wow, the number of years that these poor, mostly women, um,
Yes,
suffered, and then just desperately trying to lose the weight that was gained from it's very hard. So I definitely feel for them, and we do have many resources at NADF to support them. But I do agree, for the community support, that the Cushing's group is excellent, and there's a pituitary group as well that's
yes.
excellent. So I encourage you all to check out what we have on our website. And we do have a support group for Cushing's as well. So yeah, so check that out. So we're gonna have to move on to our next session now, but you were able to answer most of the questions. So
Okay, good.
wonderful.
Thank
Thank you
you.
so much for joining us. I'm a big fan of Duke, and I really appreciate you being here today.
Thank you. Thank you so much. Thank you for having me.
All right, have a great rest of your day. See you everyone at the next session.